The risks that weight loss pens hide from you. Know very well what you are using before it's too late. If you are currently using a weight loss injection pen, or if you are considering starting one, this video might be one of the most important things you will ever watch. Not because we want to scare you, not because we are against progress in medicine, but because there is critical information circulating right now that millions of women are simply not being told before they start treatment. And that silence can change lives permanently. Today, we are going to talk about something that is making headlines in medical offices and fertility clinics around the world. The link between GLP-1 weight loss injection pens like Ozempic, Wegovy, Mounjaro, and similar medications, and a significant documented increase in unintended pregnancies. A doctor is warning millions of women, and you deserve to hear this clearly, completely, and honestly. Stay with us. Because by the end of this video, you will understand exactly what these medications do inside your body, why they interact with your hormones and fertility in ways nobody warned you about, what the real risks are if you become pregnant while using them, and what you absolutely need to discuss with your doctor before taking another dose. Let's start from the beginning. Over the past few years, a new category of medications has completely transformed the weight loss industry. These are called GLP-1 receptor agonists, a class of drugs that were originally developed to treat type 2 diabetes, but were later approved for chronic weight management in adults with obesity or overweight-related health conditions. The most recognizable names you've probably heard are semaglutide, sold under the brand names Ozempic for diabetes and Wegovy for weight loss. Tirzepatide, sold as Mounjaro for diabetes, and Zepbound for weight loss. Liraglutide, sold as Saxenda and Victoza, and several others currently in development or recently approved. These medications work by mimicking a naturally occurring hormone in your gut called glucagon-like peptide 1. When you eat, your body releases this hormone to signal to your brain that you are full, to slow down the emptying of your stomach, and to help regulate your blood sugar. These injection pens essentially amplify that signal dramatically, telling your brain you are full, you don't need to eat, even when your stomach is nearly empty. The results have been stunning from a weight loss perspective. Clinical trials showed that people using Wegovy lost on average 15 to 20% of their body weight. Some lost even more. For people who had struggled with obesity for decades, who had tried every diet and exercise program imaginable, this felt like a miracle. And in many ways, medically speaking, it was a significant breakthrough. But here's what the commercials don't say. Here's what the beautiful before and after photos don't show you. In 2023 and into 2024, something unexpected started happening in clinics and fertility centers. Women who were using GLP-1 injection pens and who believed they were protected from pregnancy, either because of their weight history, their birth control methods, or simply because they hadn't been able to conceive before, started showing up pregnant. Not a few women, not isolated cases. Enough that doctors, OB/GYNs, endocrinologists, and reproductive medicine specialists started talking to each other, comparing notes, and eventually sounding the alarm. One of the most prominent voices in this emerging conversation has been Dr. Daria Rostami, a reproductive endocrinologist who has been treating patients using GLP-1 medications and has seen firsthand the fertility changes these drugs can trigger. In interviews with major medical publications and health media, she and colleagues like her have issued clear, urgent warnings. Women using GLP-1 weight loss medications need to understand that these drugs can significantly increase their fertility, sometimes to a degree they did not expect and were not prepared for. If they are using oral contraceptives, there is strong reason to believe the effectiveness of those contraceptives may be compromised. This is not a theoretical risk. We are seeing it in real patients. Let's break this down into its two core mechanisms, because understanding the why is essential. The first reason these pens increase pregnancy risk has nothing to do with the drug's direct chemical properties. It has everything to do with what the drug does. It causes significant, rapid weight loss. For many women, particularly those with obesity, PCOS, or hormonal imbalances linked to excess body fat, Carrying extra weight disrupts the hormonal axis that controls ovulation and fertility. Excess fat tissue is not just passive storage, it is hormonally active. It produces excess estrogen, disrupts insulin sensitivity, and can effectively suppress ovulation in some women for months or even years. This is why infertility is so common in women with obesity and polycystic ovary syndrome. Their cycles become irregular, their ovulation becomes unpredictable. Many eventually stop ovulating altogether or ovulate so rarely that the chances of natural conception drop dramatically. Here's where GLP-1 medications enter the picture in a way nobody fully anticipated at scale. When a woman loses 10, 15, or 20% of her body weight rapidly, as many women do on these medications, her hormonal profile can shift dramatically and quickly. Insulin resistance improves, androgen levels drop, the hypothalamic pituitary ovarian axis, the hormonal communication system that controls your menstrual cycle, can suddenly wake up and begin functioning more normally. In plain language, women who had not been ovulating start ovulating again. Women who had irregular cycles start having regular cycles. Women who believed they were effectively infertile discover, to their shock, that they are no longer infertile. This is medically wonderful in many contexts. For women who want to get pregnant, the fertility restoration that GLP-1 drugs can facilitate, often without the need for IVF or fertility treatments, is genuinely life-changing in a positive way. But for women who are not trying to get pregnant, and who may not have been using reliable contraception precisely because they believe they couldn't conceive, this is a dangerous surprise. This is the second mechanism, and in some ways, it is even more alarming, because it means that even women who are using birth control may be at risk. GLP-1 receptor agonists slow gastric emptying. This is actually one of the mechanisms by which they cause weight loss and reduce appetite. Food sits in your stomach longer, you feel fuller for longer, and you eat less. It's an elegant pharmaceutical trick when it comes to calorie reduction. But your stomach doesn't only process food, it processes medications too. Oral contraceptive pills, the most widely used form of birth control in the world, are absorbed through your gastrointestinal system. They are designed to be absorbed at a specific rate within a specific window of time in order to maintain the consistent hormone levels that prevent ovulation. When a GLP-1 medication dramatically slows your gastric emptying, it can delay and alter the absorption of your birth control pill. The hormones in the pill may not reach your bloodstream at the right time, in the right concentration, to maintain effective contraceptive protection. This is not a proven, fully established pharmacokinetic certainty. There is active research ongoing, but the clinical observations and early studies are compelling enough that multiple medical bodies and drug prescribers have begun issuing guidance. The FDA label for some of these medications even contains warnings about this interaction, though they are often buried in technical language that patients never read. Dr. Sarah Hussein, an endocrinologist at a major academic medical center in the United Kingdom, was among the first to go public with this concern. In a widely shared statement, she put it bluntly: if a woman is taking the combined oral contraceptive pill and also using a GLP-1 weight loss injection, she should not assume she is fully protected from pregnancy. The mechanism by which these drugs slow stomach emptying can interfere with oral contraceptive absorption in a clinically meaningful way. Until we have more definitive data, I advise all my patients in this situation to use an additional form of contraception. The statistics and mechanisms matter, but what makes this story real, what makes it urgent, are the women behind it. Online forums, patient communities, and social media groups dedicated to GLP-1 users have been flooded in recent months with stories from women who became pregnant unexpectedly while using these medications. Some of these women were thrilled. They had wanted children and had struggled. The medication in restoring their fertility gave them something they had stopped hoping for. But many others tell a different story. women in their early 40s who believed their reproductive years were behind them, women who were using birth control and assumed they were protected, women who had medical conditions, prior surgeries, or personal circumstances that made an unplanned pregnancy deeply complicated, women who faced agonizing decisions they had never anticipated making. One woman, writing anonymously in a popular health forum, described her experience this way. I had been on Ozempic for about 4 months. I had PCOS my whole adult life and had been told by multiple doctors that natural pregnancy was unlikely without intervention. I was on the pill, but honestly, I'd gotten a little casual about taking it on time because I thought, why bother being so precise? I was shocked. I genuinely did not believe the test at first. My doctor told me afterward about the gastric emptying issue with the pill. I wish someone had told me that before. This story is not unique. Versions of it are being told in clinics across the United States, the United Kingdom, Australia, Brazil, and every other country where these medications have gained popularity. Now let's address the other critical question. What happens if a woman becomes pregnant while using a GLP-1 injection pen? The answer is sobering. GLP-1 receptor agonists are currently classified in the highest pregnancy risk categories in most countries, meaning there is evidence of risk to the developing fetus, and the medications are generally contraindicated during pregnancy. Animal studies, which, while not perfectly predictive of human outcomes, are the primary data available, have shown concerning results. In rodent and primate studies, exposure to semaglutide and similar drugs during pregnancy was associated with increased rates of fetal malformations, reduced fetal body weight, skeletal abnormalities, and increased fetal death in some high-dose studies. These findings do not mean the same outcomes are certain in human pregnancies. Animal studies often use doses far higher than those used clinically in humans, and the drugs have not been deliberately tested in pregnant women for obvious ethical reasons. But the precautionary principle in medicine is clear. When animal data raises red flags and human safety data is absent, these medications should not be used during pregnancy. The FDA, the European Medicines Agency, and health authorities in countries around the world have issued guidance stating that GLP-1 receptor agonists should be discontinued at least 2 months before attempting conception and immediately upon discovery of pregnancy. The half-life of some of these medications, particularly the long-acting injectable formulations like semaglutide, means that the drug can remain in your system for weeks after your last dose. This is not a medication you can simply stop taking the day you get a positive pregnancy test and assume your fetus was never exposed. For women who have become pregnant while on these medications without knowing, this creates enormous anxiety and uncertainty. Obstetricians and maternal fetal medicine specialists are now seeing more of these cases and navigating difficult counseling conversations with patients who had no idea they were exposed. Who is most vulnerable to this specific combination of risks? The answer, when you think through it, makes complete sense, and it points to a population that deserves particular attention and more proactive counseling from their prescribers. Women with polycystic ovary syndrome are among the most at risk. PCOS is one of the most common indications for prescribing GLP-1 medications because insulin resistance is central to PCOS, and these drugs directly address insulin resistance. These are also among the women most likely to have been told or to believe that they have difficulty conceiving naturally. The restoration of ovulatory function in this group can be rapid and dramatic. Women in their late 30s and early 40s are also particularly vulnerable. Women who are approaching perimenopause may have irregular cycles and may assume their fertility is declining naturally. GLP-1-driven weight loss can, in some cases, temporarily improve hormonal function and restore ovulation, even in women who thought their reproductive window was closing. Women using oral contraceptives face the gastric emptying interaction that may reduce contraceptive efficacy. Women who have relied on the pill for years and have never had a failure may be caught completely off guard by an unintended pregnancy. And perhaps the largest group at risk are women who were not using contraception at all, those who had been told by doctors or believed based on past experience that natural pregnancy was unlikely. This group may not be using any protection whatsoever. The medical community has begun to respond to this emerging issue, but the response has been uneven. Some prescribers are now routinely counseling all women of reproductive age about fertility and contraception before starting GLP-1 therapy. Others are not. Here is what reproductive endocrinologists, OB/GYNs, and endocrinologists who are most engaged with this issue are recommending. Every woman of reproductive age who is prescribed a GLP-1 medication should discuss her contraceptive plans with her doctor. This should not be optional. It should be standard of care. Women who are using oral contraceptives should discuss with their doctor whether switching to a non-oral method is appropriate. IUDs, implants, injections, patches, or barrier methods are not subject to the gastric absorption interaction that affects the pill. For women who want highly reliable contraception while on GLP-1 therapy, these methods may be more appropriate. For women who are trying to conceive, the guidance is to discontinue the medication at least 2 months before attempting pregnancy, use barrier contraception during the washout period, and inform your OB/GYN of your medication history. If you discover you are pregnant while on these medications, stop immediately and contact your doctor. Do not wait. Do not finish the current injection pen cycle. Seek immediate guidance from an obstetric provider and disclose your medication use fully, and monitor your cycle carefully. Any significant change, more regular periods, heavier periods, a return of periods after absence, should prompt a conversation with your doctor about what it might mean for your fertility status and contraceptive needs. This story is ultimately about more than just one drug and one side effect. It is about a broader failure in how new blockbuster medications get rolled out into the real world. GLP-1 medications were studied extensively before approval. The clinical trials were large, rigorous, and well-designed. But clinical trials have limitations. They are typically conducted in controlled populations over defined time periods with careful inclusion and exclusion criteria. They are not designed to capture every downstream consequence of a medication that will eventually be used by tens of millions of people across every demographic, every life circumstance, every combination of co-medications. The fertility effects of GLP-1 drugs were not invisible. There were signals in the data, but they were not prominently communicated. They were not translated into clear patient education at the point of prescription. They were not built into standard clinical protocols for women of reproductive age. When a medication becomes as popular as Ozempic and Wegovy have become, when it appears in celebrity interviews and magazine covers and social media testimonials, the volume of use outpaces the careful, individualized counseling that should accompany it. Women are getting prescriptions from telehealth platforms, from primary care doctors, from weight loss clinics, many of whom have not been specifically trained on reproductive medicine interactions and may not think to raise these questions. The result is what we are now seeing, a wave of unintended pregnancies that are, in many cases, entirely preventable with better information. If you are a woman of reproductive age currently using a GLP-1 weight loss injection pen, here is a clear action plan based on current medical guidance. Schedule an appointment with your prescribing doctor this week, not someday. This week, ask specifically about the fertility and contraception implications of your medication. Review your contraceptive method and discuss with your doctor whether switching to a non-oral method is appropriate for you. If you are not using any contraception because you believed you were unlikely to conceive, reassess that assumption now. Take a pregnancy test if you have any reason to suspect pregnancy. If your periods have changed, if you have been experiencing nausea beyond what is typical for your medication, if there is any possibility you could be pregnant, test. Early testing is essential. Share this information with other women you know who are using these medications, your sister, your friend, your colleague. This information is not yet reaching everyone who needs it. And if you are planning to become pregnant in the next 6 to 12 months, talk to your doctor now about the appropriate timeline for discontinuing your medication and what to monitor during the transition. We are living in a moment of genuine medical innovation. GLP-1 medications have helped hundreds of thousands of people achieve meaningful, sustained weight loss and improve their metabolic health. That is real. That is important. We are not here to demonize these medications or to say that no one should use them, but we are here to say loudly, clearly, urgently that information is protection, that every woman who uses these medications deserves to know exactly what they do, including the effects nobody put in the headline, including the effects that sound surprising or inconvenient or complicated to explain in a 30-second advertisement. The risks that weight loss pens hide from you, you deserve to know them. You deserve to make decisions about your own body with full, honest, complete information, not after something unexpected has already happened. Talk to your doctor, ask the hard questions, and share this video with every woman you know who might need to hear it, because knowing sooner is always better than finding out too late.